In fact, we have a fellow who is going to present in this meeting on Saturday that he's going to talk about our preclinical results of this AMG 701. The AMG 701 is a long half-life BiTE compared to the first BCMA BiTE that has been shown clinical response. And the advantage of AMG 701, we hope that we can see, because with half-life is longer, so they may stay in the patients longer, so it will prevent infusion discomfort of patient, because currently AMG 420, because it's very short half-life, so you have to treat patients continuously treatment, and patient is one of the disadvantages of these very small molecules. However, it's very effective, so AMG 701 kind of a new version try to improve AMG 420 that has already shown a very high response rate, and will also be presented in this meeting about the phase 1 or phase 1B studies. And in this study, we also demonstrated not only AMG 701 can directly target tumor cell, lyse tumor cell very potently, but also in the presence of lenalidomide, that is an immune-modulating drug that has been standard care in multiple myeloma in the newly diagnosed, in every stages of diseases, including maintenance stage. We found that combination of these two drugs can further enhance AMG 701 induced T-cell directed MM cell lysis. And we can demonstrate that in ex vivo models using myeloma cell lines and also patient myeloma cells. In addition, we also demonstrate high response rate in the co-culture when there's a myeloma promoting components such as osteoclast, bone marrow stromal cells. Both of them can protect myeloma cells. So in this setting, we still see a very potent, strong AMG 701 induced myeloma cell lysis. Very importantly, we also have in vivo data to support AMG 701 can work very well as a monotherapy, but also in combination. In the very suboptimal dose, where you can see a myeloma regrowth after it was inhibited by either agent alone, only when in combination, tumor regrowth will be blocked. So this data indicate that by this kind of combination treatment, we can further prevent tumor regrowth or relapse. So this is very exciting data that I think has already set the stage, provide very rational data to further develop this drug in combination with lenalidomide in the relapse, very heavily treated myeloma patient left without any treatment.